Welcome, everybody. I'm very excited to be with you all today in learning. And my place of residence is Olympia, Washington. And I live on the traditional territories and ancestral homelands of the Nisqually, the Coast Salish, Cowlitz, and Chehalis nations. And I want to acknowledge the painful history and the forced removal from this territory and pay our respects to this diverse Indigenous people still connected to this land. And give thanks to all the tribal nations and ancestors of this place. And I think we are going to put into the chat, and if any of you are interested, love to know what tribal lands that you're on. There is a link there for you to find out if you don't know. Next slide. So just a little bit before we dive in about the Population Health Innovation Lab. And as you heard, we are a program of the Public Health Institute. And for us, our nirvana really is about supporting the success and impact of health-focused multi-sector collaboratives. And we do that through a variety of different services, all with a focus on learning and iteration. And just listed here are some of the services that we provide. So just wanted to offer that up. And today is one example of one of our offerings. And for today, I'm very excited to do this in partnership with Josh. And we're going to have an in-depth discussion, during this on this web discussion on misinformation. And it appears there is a lot of interest. We had 163 people that registered for that, which is pretty amazing. So I think it's interesting. We're going to learn what does it look like, what it means, and why it matters. And following the presentation, so we're breaking this up, we're going to have some time for you to interact with each other and have some breakout rooms. And, here kind of, so you'll be able to dialogue about what your experiences are. And then we're going to learn more about 5 keys for misinformation. And now I want to introduce my partner and colleague, Josh Gryniewicz. And Josh is an author, he's a health communicator, and he's the founder and chief narrative strategist of Odd Duck, a storytelling for social change consultancy. Over a decade ago, he started his communication career in public safety space, working on a controversial violence prevention program. And today, Odd Duck specializes in population health and mental wellness. He has helped cultivate narrative strategy for disruptive healthcare organizations, innovative, unique content, including a comic book platform for depression prevention in teens, and presented storyteller trainings for multi-sector data sharing. Over the past 2 years, Josh has contributed to community-forward COVID-19 responses in Black and Brown communities throughout Chicago, Baltimore, New York, Philadelphia, and New Orleans. This work informed these 5 keys for managing misinformation, which you're going to hear about today, which he used to advise organizations on developing counter narratives for anti-vaccine, vaccine hesitancy programs, and crafting community forward responses. And with that, I'm going to turn it over to Josh.
All right. Thanks, Sue, and thank you for everybody for coming out today. Okay, so just to start off, again, the name of the presentation is our Polluted Media Landscape, Sensemaking for Misinformation Management in Community Health. Polluted Media Landscape is a term that actually comes from, oh, nope, we're not supposed to be there yet. It's actually a term that comes from Whitney Phillips and Ryan Milner in their book, You Are Here, which is a fantastic primer on everything that we're going to be talking about today. They take a very academic approach, but it's also an exciting and engaging book. And so I just wanted to give a shout out to them for the title and for the kind of overall metaphor that's sort of driving some of this thinking around the media landscape. So I would like to start, let's see. Okay, there we go. I would like to start with history's most successful sock puppet. 2nd century Rome, Glycon, half man, half snake god was all the rage. He was the product of Alexander Abontakis, who was sort of a puppeteer, a prophet, and a profiteer who operated out of what is modern day Turkey. He formed a cult quite literally out of a sock puppet, and he was sort of like a proto L. Ron Hubbard, P.T. Barnum of his day. In 160 CE, Alexander bought a small, harmless garden snake, wrapped it around his body, tucked the head in his armpit, and put a sock on his hand. And the sock he marionated like a puppet, and shared predictions for the future for a few bucks. Now, we would not be talking about Alexander today. He would not even be a footnote in history were it not for the fact that when he established his cult, the myth of Glycon happened to coincide with the Antonine plague that was ravaging the Roman Empire at that time. So as a result, Glycon's popularity exploded. Temples spread everywhere. Money was literally printed with Glycon's likeness on it. Scriptures from the prophecy of Glycon were placed over doors to stop the virus from crossing the threshold. And Glycon's popularity actually outlasted Alexander himself by over 100 years, and Alexander lived well into his 70s. So you have nearly 200 years in which this cult was operating at its height. Prophecies and folks who were paying about 80,000. They were making about 80,000 drachma a year, which adjusted for inflation is around like 2 million. And in fact, Glycon became so well known that the emperor Marcus Aurelius himself paid a visit to make predictions about the outcome of a battle. So Marcus Aurelius is literally the guy who wrote the book, or at least a book, on Stoicism, and he was even seeking out the prophet. And that probably doesn't have to do with his beliefs as much as the popularity of the cult meant that he had to do a show of faith. So in large part, why are we talking about this now? In large part, I want to demonstrate the fact that misinformation and misbelief is as part and parcel of the human experience throughout history as viruses themselves. Okay, and can we jump to the next slide, please? So why is this? Jamie Holmes, author and researcher, says we tend to see patterns in his book Nonsense. He says we tend to see patterns where none exist when faced with contradicting opinions, uncertainty, or other people's ambiguity, to embrace certainty when none is justified. And he goes on to say that, in fact, the bigger the event, the more that we tend to embrace the more that we tend to embrace a conspiracy theory about it. And of course, there is no bigger an event than a global pandemic, or few bigger events than a global pandemic. Could we jump ahead a couple slides, please? Okay, so here, this is actually the World Health Organization at the start of the pandemic declared an infodemic that was accompanying it. This is the first time that they actually gave a name to this. It's a blending of information and epidemic. Sylvia Bryant, who was the World Health Organization information architect who was working on this, said that with social media, this phenomenon is amplified. It goes faster and further in the same ways that the virus travels faster and further with people. So the new challenge is a challenge of timing, because you have to be faster to fill the void. And we're going to talk about that void a bit throughout this presentation. What is at stake during an outbreak is making sure that we're doing the right thing to control the disease or to mitigate its impact. And then on the other side of this slide, you see the conspiracy theories and misinformation that was spread in the first 6 months of 2020 and arranged by popularity and how they were trending. I have that included, but the very real consequences of this, right, are that in the first 3 months of 2020, 6,000 people were hospitalized due to reactions to misinformation. You see that the most popular there is miracle cures, and some of those miracle cures ended up with folks in the hospital. And then during this period as well, at least 800 people may have died related to misinformation as a result of misinformation related to COVID. So next slide, please. So how I got into this work in 2010, I was working for a controversial public health program, as Sue mentioned. That public health program was often the target of both misinformation and disinformation that often derailed it or threatened it. As a result, I was tasked with and spent a large part of my job researching the phenomenon in different contexts, historically and internationally. I guess everyone needs a hobby, right? And in March of 2020, my avocation and my vocation came together. I was recruited to work on a team to develop a public education approach to COVID in Black and Brown communities in Chicago, New York, Philadelphia, and Baltimore. My team included community engagement experts, an infectious disease specialist, public health expert, and then I was contributing as the communicator, storyteller on the team, and we designed, developed, and delivered messaging to community teams in all of those aforementioned cities. And so everything that I share with you today, the 5 key findings and so on, were really based on a postmortem that we did, analyzing what went well with the campaign, what didn't, what we needed to double down on in campaigns in the future. Throughout 2021, we actually reached out to authors, experts, academics, documentarians, and public health professionals, and talked about what our key findings were and tried to say, well, are there any techniques that people can use to apply to do this more systemized? Because we were just flying by the seat of our pants when we started, right? And this included actually other campaigns that were combating misinformation that we were comparing notes with in the Syrian refugee community, libertarian groups in upper state Washington, and then when the vaccine was released, actually advising on some vaccine hesitancy campaigns. So if we could jump ahead one more slide. Awesome. So this is actually from Everytown, and it's a quote from a report they did. Half of the community engagement specialists who worked on the team that I was on continue to advise Everytown. And so what they concluded was communities of color and poverty are being particularly hard hit by the pandemic and very underserved in terms of information on keeping safe. And so this is true of Navajo communities on the reservation that we heard about, where they literally had to go old school to get the word out with station wagons that were equipped with speakers, just driving up and down streets and holding up cardboard signs to provide updates on what was happening with the virus. It was true in other rural communities, and it was true in the communities that we were working with, where we were encountering everything from, like the conspiracy theories around 5G, or that the pandemic was incubated in a lab, or all of these different things that we had to confront. And then just to step on a soapbox and riff, and this is not, I'm not attributing any of this to Everytown, this is just me, as the revolution in healthcare that we're hoping is part of like the new normal, and that many of us are trying to advance, that's more, let's say, preventative based rather than treating disease after the fact, and more community based. I feel like information needs to be considered as part of a social determinant of health in the same way other resources do, as anything else. And so that's my little soapbox moment. And if we could jump to the next slide, we'll get into, okay, so what this is and what this isn't. What this is, differences in misinformation, disinformation, and different types of misinformation, disinformation. We're going to talk about these 5 keys to navigating a polluted landscape. Again, that we broke down from a postmortem on this campaign. We're going to talk about the importance of taking control of the narrative and the brand. And then we're going to talk a little bit, hopefully, about where we go from here. What this isn't, a lot of the countermeasures that people talk about are about media literacy. We're not going to get into that today. There's no political agenda here, so I want to be very clear on that. I'm not an academic. I play one on Huffington Post sometimes as a ghostwriter, but I'm not an academic. And so this isn't academic research. But I will, wherever possible, cite my sources and share those with you. And then there is some phenomenal work happening in Europe, Asia, and throughout Africa, and phenomenal researchers working on that. But we're going to keep the focus domestic, and we're going to keep it focused nationally. If we could go to the next slide, please. All right, so misinformation actually occurs sort of on a continuum. There are actually 6 buckets that we're going to talk about today. There are only 4 listed on this slide because these are the most common, and also that's all that fit on the slide. But on the next slide, we'll get into some more specific types of misinformation. So the first thing to clarify, even a lot of researchers will conflate misinformation and disinformation. I try to keep them separately. I'll explain why. But I feel like they're very different categories. And the main distinction is that misinformation is false or inaccurate information that's often shared without any kind of agenda. So unfortunately, the way that the virus breaks out, this is sort of what Sylvia Briand was talking about with the gap. This is in many ways how science sort of works, right? Like we only know what we know at the time that we know it. And so when you're dealing with something like the virus, so I've spoken with epidemiologists across the country who at the beginning of the pandemic weren't really sure what they were looking at. They were coming out of a long flu season. In some instances, they didn't break things down by ethnicity or race. So there was a lot of confusion. And that confusion, once it's shared, becomes misinformation. Not intentional, not with an agenda, but it becomes misinformation. Disinformation is where the opportunists come in. And so disinformation is when misleading information or misinformation is hijacked and often coupled with a political or in some cases profit motive. It's often referred to as dark propaganda. And as we already discussed, it's kind of conflated with misinformation, but it's its own distinct category. Propaganda, we all, for the most part, probably know what that is. It's, Jeff Gomez, who is a thinker in the space, he's promoted collective journey as a theory and talks a lot about weaponized narrative, which we'll get into a moment. But he calls propaganda sort of like the one big lie. So that's information with an agenda, and it's often advancing or biased to promote a cause. And then finally, fake news. We've heard a lot about this. We've heard this term a lot. It's demonstrably false news stories, sensationalist in character. And oftentimes what happens is that, it's aimed at discrediting. So going back to the organization that I worked starting in 2010, we had lots of fake news stories that were aimed at trying to undermine the organization, undermine its credibility, undermine the results that it was getting. That was specific with an agenda, but fake news also falls under the category of like clickbait, right? So a lot of times there's sensationalist stories that are ascribed to celebrities or so on, and they're not necessarily to knock folks down a peg, but they're just to get attention and to get traction. And if we could jump to the next slide. All right, and here's two kind of special categories that I wanted to refer to. The first is dangerous speech. This is speech that's calibrated and calculated specifically to rile people up against members of another group. Rachel Brown, who works with an organization called Over Zero, has done some phenomenal work in this space, creating sort of like counteracts to dangerous speech or hate speech. And then there's weaponized narrative. And weaponized narrative, again, one of the things that Jeff Gomez, who's a researcher in the space, differentiates weaponized narrative from propaganda is that propaganda has, the one big lie. It's trying to put forward, what the party line is on, whatever the issue is. What weaponized narrative does that's different is weaponized narrative doesn't care about cohesion. It just infuses a lot of mixed stories. We saw this, near the beginning of the election where, it was different stories were just coming out and it was hard to get a read on them or to understand, what was being put forward. And a lot of times, unfortunately, the agenda is actually to create chaos, to create confusion. And so that I feel like out of all of these, that's the scariest of them all. So that's kind of the 6 buckets of misinformation, if you will. And if we jump to the next slide. So this is Rene de Resta. A lot of this work is based on her research. She comes out of Stanford. She actually says in this report, slow and unclear communication from health authorities revealed gaps in how authoritative information reaches people in crisis situations. So again, she's talking about this void that we were referring to. And what happens is opportunists can step into that void, and when authorities are disregarded, they can hijack those stories, those narratives for their own purposes. And then she goes on to say, when there is no reputable content to return, bad information often fills the void. All right, so we're going to pause here for questions. And before we get into the keys, we're going to jump into some conversation, some of the conversation and breakout rooms, and then we'll go into the 5 keys.
It looks like, Josh, there's a couple of, I don't know if we want to take down the slides for a minute, if you want to see people, or if, looks like there's some comments. I don't know. I'm just going to look through real quick and see if there's any questions, that come out. Ria stated, my team has also seen these ideas and research from the Frameworks Institute.
Great.
That's awesome. And you had made a comment around this notion of information being considered as one of a social determinants of health. I'm not sure that I'd heard that before, but I like that. And Ria also made a comment that, oh, and she's excited. You pronounced her name right. Yay. Yeah, that's awesome. So yeah, I don't know if anybody has any questions, or it's a lot of information. Yes.
I have something that I could maybe say.
Please.
So Sandy Tipke, I'm from North Dakota. I'm funded largely from the North Dakota Department of Health, but their concern and why I'm starting the new nonprofit, North Dakota Healthy Communities Coalition, is really about misinformation and trying to collect community members at the grassroots level that are supportive of, the right information, as opposed to misinformation, and how to build connection and community values in order to change how that dialogue is happening at the local level and the grassroots level, so people aren't so scared to step forward. I'm sure, like with a lot of states, it's scary for community members to talk about being pro-science, considering the information or misinformation that's coming forward in our state and other states. So really, it's just what are the next steps? It's so huge. It's really not a question, that you can answer just right now, but it's a huge concern, and it's sort of like I'm building blocks and trying to make sure I'm putting it all together appropriately before I move forward. And actually, I am working with the Frameworks Institute as well. So. But this is amazing. I'm so glad I'm on this.
Oh. Well, and what I wanted to just to say, I think the 5 keys will sort of get into some of the breakdowns of some of the specifics that you're looking for, but that is the challenge, right? When you're dealing with something that's on that scale, that's moving so fast and has so much volume, it is difficult to sort of punctuate. But hopefully when we get to those 5 keys, there will be, you know, certain things that you can kind of tease out and go, oh, okay, this is something that I should look to.
Mm-hmm. Great. Sounds like interesting work. Lots of challenges there. There's a question here, Josh. It seems like mis and disinformation is getting significantly worse or more. Is that true historically?
As I understand, yes. As I understand it, yes. And I think what makes it unique about this period, as opposed to, say, you know, like you know, Roman Empire and ancient history, is the fact that we have the internet that kind of blows things up on a major scale and sort of moves things forward at a macro level. And so that's, yeah, I think the key differentiator there is often, you know, social media and platforms and just the sheer reach of misinformation.
Mm-hmm. Mm-hmm. Great. Let's see. Do you have reference slides for the books? So I don't know.
But Ria, if you reach out to me, I will send you any footnotes that you want. And that goes for anybody. I'll share my email at the end of this. The book itself is by Whitney Phillips and Ryan Milner, and it's called You Are Here. And also, I'll say both of them. I want to encourage everybody to reach out to them, but they are very approachable as well. And I've had a number of conversations with them about the book.
Mm-hmm. Great. Hi, Christina. I'm so glad you're with us. I see you have a question in here. Can you please reiterate the difference between disinformation and propaganda?
Sure, absolutely. So disinformation is often referred to as dark propaganda, and that's kind of like a smaller scale, whereas propaganda is sort of like an entire apparatus. So that's an entire framework advancing propaganda on a scale to, you know, again, as Jeff Gomez puts it, advance one big lie. Whereas the disinformation is often just sort of little narratives and story pieces to kind of influence things, or, you know, it could just be a tidbit, you know, or an anecdote that's kind of put into the mix, and that isn't necessarily at the scale of propaganda, but it's something that has a little bit of influence. Does that make sense? Hopefully.
Yeah, Christina. Oh, got it. Good. Great. Awesome. Very good. Let's see, any other questions, comments? Great. Okay, well, we wanted to provide an opportunity for you to be in dialogue with each other. There's people from all over the place, which is pretty exciting and interesting. So as we do in our web discussions is put people into breakouts. We don't know it all, and I think we love to have learning. So we are going to randomly put you into groups of about 3 to 4, no more than 5. And these are some discussion questions that we came up with, really. It's just like, what experiences have you had with mis or disinformation? And some examples, right? School board hearings, there's city council, there's all kinds of things happening. And love to hear like what solutions or approaches you've tried, you know, what's working, what's not, what didn't work, and maybe where are you stuck, and what could you use help on? So we wanted to just take a little bit of time to hear from you all. Tara, would you actually, or whoever's doing the, like do a gallery? I'd love to, if people would be brave and share your faces. I would love to see you and hear how it went for you all. Anybody like to share? Josh, I saw you ventured into a room. That's awesome. Good for you.
Vindicating, actually.
Was it? Oh, good.
Yeah,
good.
I learned a few things from Don-Yves and John, who are both community health workers in their own right. So it was sort of like, okay, I'm going to shut up because I'm preaching to the choir here.
Yeah, that's awesome. Yeah, so I'd love to hear from folks. Anybody'd like to share, and also if you'd like to put any comments in the chat, The video's not working. John, do you want to share? You don't have to be on video, but if you want to speak to anything that came up in your room.
Sure. Yeah. So just talking with Danive and Josh, we realized that we're doing similar projects, pretty much identical, and he's a little bit further ahead than we are, and the point that we are in the contract, he's already began doing, and just trying to get an idea of what would be the best strategy to complete listening sessions where he has had success or failures, and how we can implement maybe a strategy that will allow us to hit our deliverables the same way that he has. So just trying to tap into him and his knowledge of the programs that we're both working on, and I learned a lot in that short period of time. Yeah,
that's awesome. Yay. Very serendipitous, right?
Yes.
Katie.
Very generous also.
Yes, he is a very generous guy. Katie, I see you have your hand up. Hi.
Yes, hello. Sorry, hold on, my camera's on the other side. So our group kind of talked about a couple of things. I think after kind of sharing our experiences, just learning that the information that's being shared isn't always wrong information. It's information out of context. And kind of just people learning to experience the scientific process is a lot of what we've had to deal with. I come from an academic background, and I have done a lot of research and data work. And so learning that this is normal for me may not be normal for everybody else, right? So how do we tell people that, yes, you got your information from a good source, but you're misinterpreting the information? That's not actually what that says. Because we do have so much access to lay people have so much access to good, meaningful data, right? Science doesn't want to be the gatekeeper and be like, you guys can't have this, but we put this information out there, and then people who don't have an understanding of what's actually happening are using that information incorrectly. And so that's, it's kind of a double-edged sword. How do we keep people from using information in the wrong way and misinforming their decisions?
Great. There's some awesome comments, Katie, that are coming in just as you're speaking, that I think are great, as in the difference between scientific theory and some person's theory. But I think maybe it sounds like just some revelation of not everybody's in the same position that you are, and just having that perspective and lens is really helpful. So.
And just to add, because I was in Katie's room as well, had we had leadership at the time when this was breaking out that actually said, hey, this is all new. We're going to be going through a process here, and there's going to be a lot of twists and turns, because as new information is learned and developed, right, we'll be making different decisions. And because we have that, I think people started jumping to conclusions about the data and about the information, and then started discrediting the scientific sources. And that, that discrediting part is I'm looking forward to hopefully getting some help around how to navigate that. How do we regain that confidence in the community and in our public health community? So that was
great. Thank you. Thanks so much. Any other comments? Anything that came out of your group? Peter, I see you. You're flashing up on my screen. I'd be curious if you had any insights or anything you want to share, just given some of the things you've done.
Yeah, well, I'll say in our breakout room, we did talk a little bit about some of the contextual kind of differences for misinformation, because we're coming from different contexts, living in Vermont, living in Chicago, working in North Dakota, that misinformation takes on different forms and different bases. And one of the last projects I worked on at my previous position at the Chicago Center for HIV Elimination was focused on the differences in vaccine hesitancy for specifically queer and minority groups, especially people who have been affected by HIV and AIDS, and the historical relationships, the systemic traumas that were inflicted through kind of the AIDS crisis on the Black community in Chicago's South Side, produces a medical distrust that is much different from the kinds of medical distrust that we might be seeing in other vaccine hesitant areas. And so when we're talking about misinformation and we're talking about these different cultural contexts, it's really important to remember the history. And I remember there being pushback even early on when people started to use the terms anti-vaxxers versus unvaccinated, and that there are different kind of historical reasons why people might not be getting vaccinated.
Thank you, Peter. Very helpful. Heather, Heather Fitzpatrick has her hand raised. Hi.
Hi, yeah, thanks so much. I really appreciate what Peter was saying there. And it kind of got to the last part of our conversation too, where we were trying to not lose hope, but also acknowledging that there is some of that certainly historical piece of this misinformation, this tension between different viewpoints. And it feels like too, and then this is just my point, I guess, is just that there's this now, after this experience, after this pandemic, and hopefully that we're moving into a recovery phase sooner rather than later, but that there's this added layer of harm, of trauma, of hurt that somehow we're going to have to sort of tackle and acknowledge rather than just let it go, because the next crisis will come, right? And so
Sure.
how do we heal some of this, or at least as much as we can, so that we're better prepared for the next time around? So just adding that piece of things.
Great, thank you. Let's see, anyone else? Christina, see you have your hand raised.
Hi, yeah, thank you. And sorry, I'm not on video. But so I was actually in a room with Stephanie, which was great to.
I know, I saw that. That's awesome.
But we were actually talking quite a bit about how personal this is for each one of us, because putting aside your like public health or public information campaign piece, I think we all have people in our lives who we love and care about, but who have been, I don't know, who embrace the kind of misinformation and disinformation, vaccine hesitant, whatever. And just to piggyback on what the previous woman was saying, I feel like there is trauma for those of us who have come to realize that the people we thought we knew, maybe we didn't know so well. And that's a nationwide trauma. We're all, no matter what you believe and how involved you've been in any of this, we've all been fully deeply affected by all of this. And it is a trauma. And I feel like it's not just about combating information campaigns. It's going to be an entire healing process that needs to happen as a nation. And I feel like that needs to be built into the information campaigns as well. This notion of approaching each other with grace and humility and caring, almost in a trauma-informed way. So we were talking more on a personal note with Stephanie. And I think that's something that we need to acknowledge as people involved in information in this space.
Great.
Can
Thanks.
I say one note about that?
Please.
Okay.
Yes.
So Christina, I think that you summarized that beautifully, but there's one thing that you said too that really stood out to me, which is we were talking about how this misinformation and disinformation and belief in what people believe to be facts is it is almost more than just a knowledge problem or a fact-based problem. It gets into like beliefs, and Christina, you used the word identity. And so that's just like, it's really challenging when it moves beyond talking about facts and knowledge and evidence, and it really gets into the space of what you believe and how you see yourself. And you know, that's a lot more sensitive than just talking about facts and what people believe to be true.
Yeah, that's right. I think I even said something like, we need to, it's almost like a deprogramming from a cult.
Yep, exactly.
Thank you, Stephanie.
I just wanted to say this is a really fun way to give this presentation, because I'm feeling vindicated before I even shared the like keys. I'm like, oh yeah, we're going to talk about that. We're going to talk about that. So this is really exciting. So thank you for validating me.
Very good, very good. Well, I'm glad we could help, Josh. Very good. Yeah, anything else before we move on to the next part? I don't see any. But thank you so much for your willingness to share. I appreciate it. And I think I've heard some things today that I'm not sure I've heard before, and it's really great that it's being named. So I think we will now go ahead and go into the next part of the presentation.
Can everybody see this all right? Let's jump into the chat. Yes.
Yep.
Okay, great. So I'm not going to read through all of these slides, but just kind of riff off of them. And the first thing I think speaks to what Christina and Stephanie were saying, but also, you know, essentially, you know, it's about validating feelings and addressing concerns. So not so much accepting these beliefs or the beliefs that are being put forward, but accepting the people who believe them. And I think that's going to go a long way to providing healing and creating some of that common ground, right? So, you know, when we initially started, you know, our team went out, and this was one of the things that we had to learn the hard way. So again, this was early in the pandemic is when we started this process. And, you know, the instinct, and this was a lot of what was being put forward by, you know, some of the team, was that, you know, we should go toe to toe, that we should actually, we had the facts, we knew what they were, and we should just, you know, sort of debate and engage in, you know, not essentially debunking some of these arguments. And what we found very quickly was more effective was opening up the space for folks to express themselves, to have conversations. And, you know, one of the things that comes to mind most vividly, again, this was when masks were accessible, so that it wasn't a lack of resources, but a lot of the young African-American males who we were talking to and who we were conversing with were saying, you know, honestly, I feel more threatened in a mask, wearing a mask, you know, from law enforcement or from somebody who's going to target me, and I'm feeling more vulnerable than some invisible virus that, you know, I can't see and I don't know about. So, you know, if we had just tried to debunk some of the concerns, if we had just sort of, you know, had a argument about facts and you know, whether or not the mask was protecting them, we wouldn't have missed that, you know, crucial detail, which was something that informed how we approached, you know, and shared sort of, you know, the messaging that moved forward. So that was crucial. A lot of this for tools and tactics that worked, motivational interviewing. Motivational interviewing, it comes out of the addiction and recovery space. A lot of time, you know, folks when contending with an addiction are very defensive, don't want to necessarily go there with, you know, being confronted by their behavior. And so they try to, you know, kind of shut down the conversation. Motivational interviewing came up as a discipline to sort of ask these open-ended questions and to activate the process and processing in the receiver and the person who is listening, and get them to be thinking about their own behavior and reflecting on their own behavior. And we had a lot of success just using those techniques and tactics in some of these conversations. So it's great for one-on-one. And you know, again, shout out to, you know, in the breakout session, Don-Eve and John are doing a lot of this stuff. But how do we do this at scale, and how do we do this, you know, on a larger platform? So part of that, I believe, is, you know, a lot of the work that Phil does, and in sort of the sense making and convening, with getting the right players around the table, at a safe distance, of course, and, you know, having conversations that actually put, you know, what they're feeling out on the table, and actually talking through some of their motivations and stuff. Other things that worked, we did, you know, some deep canvassing work. So essentially, you know, canvassing as a process. You know, you have, if you've ever volunteered politically, or volunteered or worked on a political campaign, it's usually what the candidate or the organization's platform is. And, you know, how to rebuff arguments or advance your own argument. At a certain point, in, I believe it was 2012, the LGBT community in Los Angeles lost a vote, or lost a vote around same-sex marriage. And so they had already thought it was a shoo-in. They were kind of scratching their heads and like, well, how did this go wrong? And so what they had done was said, okay, you know, let's throw out the usual questionnaire, the usual canvassing format. Let's also throw out the clipboards, and let's just go door to door and do deep canvassing, just asking folks why they voted a certain way, what their feelings were about the issue, and so on and so forth. And the responses from that were far more effective, and they were actually far more effective at changing individuals' minds. So as far as takeaways and things that can be useful, kind of moving out there, I would say the motivational interviewing, the deep canvassing, and then to piggyback off of you know, the comments that Stephanie was making as well. And again, this goes back to Whitney Phillips and Ryan Milner's work, and specifically work that Ryan has done around what's called deep mimetic frames. So these are the stories that we've internalized about ourselves, our identity, our experience, and they shape our worldview. So you're not going to disrupt those just by, you know, countering fact for fact. You're going to be able to influence those simply by putting forward, you know, or getting folks to question their own beliefs. Let's see. Sorry, having trouble advancing the slide. Can we jump to the next one? Thank you. So the next point is sort of strategic storytelling. We did a lot of work figuring out specifically what sort of stories we wanted to tell. So early on in the campaign, we knew what the health outcomes we were going for were, and what the actions that we were putting forward were. There were, you know, all the things that have become so ingrained now. You know, the masks, the safe distance, and so on. Later, we revisited this and we added all sorts of things about the vaccine and vaccine hesitancy. So what we did was we had our objectives and the outcomes defined first, and we built that into our approach. And then we literally mapped the stories that we wanted to tell with the individuals. So figuring out what some of those barriers were, you know, the threat of wearing a mask, for example, was one. Some of the concerns about vaccine, or whether or not vaccines are bad for your health, or some of the stuff that Peter was bringing up of, like, you know, communities who have had negative experiences with the medical community. And so what does that look like, and how do you identify that as a barrier through the initial, that first key? How do you identify that as a barrier? And then how do you message and construct around that in a way that is trauma informed, and in a way that helps circumvent those barriers to accomplish the health outcomes and the objectives that you're looking for? And if we could jump ahead to the next slide. Thank you. So This is actually our theory of change, so to speak. We look at this as units of narrative, meta-narrative, narrative, and lore. Those three outer are how culture, lowercase c and uppercase c operate. So this is how norms are reinforced. This is how organizations and institutions behave according to their own stories and stuff. So those three outer ones really, they're unlikely to be disrupted by any individual, organization, institution, or even a movement on the surface. These three inner rings, micro story, anecdote, and story, are how we believe you can disrupt some of that, the lore narrative or meta narratives around certain activities, certain behaviors. And so what we promote, what we say is like, that's where the strategic storytelling takes place, really refining and honing what you want to advance, so that you're going to bump up against and influence these narratives and meta narratives and so on. And if we could jump to the next slide. Okay, so this came up a lot in our small group, and it came up a lot in when we were reporting back. And it's specifically about being a trusted source as an organization. Okay, so we found even before the pandemic, actually, trustworthiness was in crisis, right? Edelman has spent the last 20 years looking at the trustworthiness of what they call the institutions at the center of our social ecosystem. So that's business, government, NGOs, and media. And what they've seen is a steady decline or erosion in the trustworthiness and the trust ratings of those organizations over the course of the last, specifically the last 20 years or so. And so all of this culminating in 2021, where they actually in their report said, what is created now, again, with those four institutions, what has been created now is an environment of information bankruptcy. That according to their 2021 barometer, we are essentially, no institution is completely trustworthy, or and again, in the spirit of transparency and owning my piece, apparently consultants rank somewhere between politicians and used car salesmen. So just owning that piece. So what we found was that being a trusted source, really in this space, in the space that we're talking about today, in health, and specifically in community health, boiled down to four key distinctions, and being able to kind of lean in on those four key distinctions. The first was to communicate authentically and transparently. I don't remember, I think it was Peter who mentioned sort of being transparent as an organization in the conversation earlier. 100%, that's what we found again and again, was being able to communicate from that space. If you haven't done so already, the second point is identifying what your organizational values, and this can be done even on a team. Identifying what your organizational values are, making them known publicly, and then living them. And so demonstrating this sort of integrity, this through line, by leading with your values. The next, and this is significant, is partnering with community in a meaningful way. And so when we say partnering with community in a meaningful way, that means not just having representation, but having representation that actually has some authority, having representation that has voting privileges, has influence over the outcomes of organizations and how the organization is directing its actions. And so that, I believe, is imperative. And I think a lot of organizations, even I would say, even some of the organizations that I advise, try to phone it in on this one. and say, well, you know, as long as we have representation on our board, as long as we have representation, you know, from the community, then we're good. And, you know, again, it needs to be real decision-making power. And then the final one is just acknowledging and owning histories of institutional oppression, or even, you know, oppression from sort of like the field that is being represented. And so, you know, distrust in going back to the campaign that we worked on, distrust in the state and distrust in governmental bodies was a big thing that we heard about again and again and again. And if we had just tried to sweep that under the rug or say, well, you know, not this time, I mean, this time, you know, then anything else that we would have said following that would have been deemed non-credible. So yeah, so those are the four things that we found. And I would also want to give a shout out to San Diego 211 and Community Information Exchange has done a lot of work around establishing an anti-racist framework. And that I think is some of the most remarkable work that I've seen in this space about sort of all of these pieces coming together. Okay, if we could jump to the next slide. And I wanted to talk specifically about, this is research out of Gallup. They wanted to know what builds loyalty to a brand, organization, or business. So they surveyed numerous people in different fields, similar to the Edelman study. And what they found is the two first steps, those are non-negotiable. Those are like make or break. If you know, essentially, if you don't do this, you've burnt your credibility. If you do this, nobody's going to pat you on the back for it. So the first is accuracy. Do you know what you're talking about? And you know, are you doing what you say you're going to be doing? Again, the integrity of the organization. The second is availability. So are you responsive? Are you answering emails? Are you answering phone calls? Are you able to assist and back up what you're doing? On the other pieces, the partnership and the advice, those are leveled up. So you know, when community gives you feedback, are you taking that feedback? Are you adjusting and adapting accordingly? And do you actually care about the needs of your community, your customers, and so on? And then advice, you know, do folks learn something or get something out of their engagement with you? Is there added value there? And have they grown as a person as a result of this relationship? So if we could jump to the next one. This is, I'm going to give a shout out again to Daniv and John, who are in my small group, because this is all about, you know, they're both you know, community health workers in their own respects. And this is absolutely what we were talking about here and what we found as well. Right messenger, right message. So people just like me, the Edelman survey found that, you know, irregardless of, you know, institutional standing, what was most important was people just like me, that was deemed the most trustworthy sources. And that essentially, you know, not institutions, not organizations, not celebrities. And I want to say one of the things that we found most remarkable out of this is we had actually written and developed PSAs for some celebrities that were reinforcing some of the messaging, but the PSAs or the videos that got the most traction, the most attention, and hands down the messages resonated most with the audience were the videos that were actually conducted by community health workers. So that was us seeing this play out in real time. And then just a comment to the communicators in the audience right now, that you know, this was something I had to be comfortable with, is, you know, it's okay to just provide the frames and to hand that off and let the community represent it in whatever way they want, as long as they're, you know, sticking to the health outcomes. Because there's a tendency to want to overscript or overproduce or make sure we get everything right. And so our role was really to step back as communicators and to just give the framework and the support and let the community message however they wanted to. So if we could jump to the last one. And I put this in because I feel, again, there's a tendency for data and facts and so on to be regarded as sort of unimpeachable. And it's like, oh, if we're going into this debate, we're gonna inundate you with facts, or we're gonna inundate you with data, and we know what's what. And one of the things that we're saying and that we found is trust allows you, as some of the folks in the conversation were saying, trust allows you to say we don't know yet. We don't have all the details yet. And so, even in a state of fear, your audience will be receptive to that if they trust you. And I feel like a trustworthy brand helps support trustworthy data. But the final piece on this is sort of the transparency, opening up, demonstrating where the data is coming from, and wherever possible, opening up your dashboards, allowing folks to kind of pair in and work with the data themselves. And I want to give a shout out here as well to My Sidewalk, who does some great work with kind of data democratization and dashboards and stuff. So those are the 5 keys, and I will pass the mic. Oh, I forgot. Yeah. Okay. So thank you all for being here. If you want to learn more about our organization, please check out oddduck.io, or feel free, and this goes for everybody who's tended to reach out to me personally. I would love to keep this conversation going. I think this is really important work, and this is crucial kind of moving forward. So I'm at josh@oddduck.io, and again, feel free to reach out.
We are the Population Health Innovation Lab. This is our website, and you can follow us on Twitter